Hi, my name is Sabrina Perry, and I will be discussing the case of Miss Floyd. So, for question one, what is your initial reaction to this case? My initial reaction was empathy for the case. She showed signs of emotional distress and symptoms such as sadness and fatigue, which could be formed into maybe depression or trauma related stress. Um, she didn't want to discuss any family or about her substance use or about her job, anything about her workplace. Um, since um it seems as though she has mistrust as well with law enforcement. There was something going on with law enforcement that she didn't want to discuss either. Or sharing with her emotions, which is normal for her to be cautious right now since this is her first time dealing with mental health visits services. So it's typical for her to be struggling to seek help, even though she's not really seems like she's really trusting of other people, so she's kind of cautious. Question two, do you think you could work with Miss Floyd? Yes, I could work with Miss Floyd. Three, if so, why? I can work with Miss Floyd because she is experiencing trauma and stress, emotional stress. Um, Miss Floyd, experiences can be addressed through counseling. She's not sure about accepting help, but it is understandable due to this being her first time. She has that self-seeking behavior, so her seeking the help is still a bit nerve-wracking for her. So it's okay for this circumstance. For if not, why not? Like I said, I would be able to work with Miss Floyd, but because she does have substance use, and if it would get out of hand, she would be referred to a specialist. But I would still work with her because she needs all the help she can get, all the support she can get, all around from everyone. Five, what are some of Miss Floyd's strengths? So the strengths that I've seen is that she has her education, she has a bachelor's degree, she has a full-time job, she has money, income coming in. Um, she has friends support. She listed like 2 or 3 friends from the case. She recognized her symptoms. She listed all the symptoms that she was having, and she recognized that something was going on. She showed that she wants to get help, even though she's never received any mental health services. So I thought that was a few strengths that she showed in the case. Question 6. What are 5 questions you would want to ask Miss Floyd in the second session, and why are they important to ask? Excuse me. For my first question, I would want to ask her, when did you first notice changes in your sleep? I feel like this question is a good question because you get to understand like what started to trigger her and where like the timeline on where it kind of all started with her symptoms. So I thought that was a good question that I would ask. Two, my second question would be, what role does alcohol play in your life? To better understand how alcohol is affecting her in her life, like does she use it when she's like getting upset, or if she's thinking of a trauma or something, somebody is there was a trigger or something, she's drinking for that reason, but with no judgmental zone. The next question would be, who are you most comfortable with when it comes to support? She does have support, but to see if she is willing to actually talk to her friends to see if they are supportive of her, or if sometimes she does have friends that are supportive, but she still isolates herself, just to see where she is. Question 4, how do you cope when you feel upset? I asked this question because just to see what coping mechanisms she has already, to see if they're healthy or unhealthy, and also giving her tips on positive ways to use these coping skills to help her in her everyday life. 5, my 5th question, how does being in therapy feel so far? So asking this question, I feel as though I'm getting the chance to see if she has any concerns. It helps me as the social worker to identify any anxiety she might have with therapy or any hesitation from her. And I'm able to check in and see what her comfort level is looking like. I feel as though these questions are appropriate because this is her second visit and with therapy, so this is still a new experience for Miss Floyd. And that's all.